Hi, I'm Dr. Rajeshwar, consultant endocrinologist and diabetologist working in the UK. These days, I'm getting lots of calls and emails from my patients with diabetes. In this desperate and concerning times of coronavirus pandemic, everybody's concerned about what should they do. Are they at high risk? So how do you manage patients with diabetes and COVID-19? Yes, people with diabetes are at high risk, and more so if the blood glucose control is bad. So based on the early data coming from China, there's a paper in the Journal of American Medical Association by Wu and colleagues, where they clearly showed that there was increased case fatality rate in people who also had diabetes. In fact, the case fatality rate for diabetes was 7.3, and those with cardiovascular disease was 10.5. So most patients, as you know, with diabetes do have cardiovascular problems. In fact, a lot of people with type 2 diabetes have some degree of cardiovascular problem, especially if they had it for a long time. So diabetes is a high-risk disease for complications, especially during this pandemic. Any illness, specifically coronavirus illness, people need to have some sick day rules. I'm sure your healthcare professional would have discussed this with you. With any illness or infection, insulin resistance goes up and blood glucose goes up as well. So there should be clear strategy for management. Also, when you're unwell and if you feel sick and you're vomiting and your food intake is reduced, you can have low blood glucose or hypoglycemia, which is a blood glucose less than 4 millimoles per liter or 72 milligrams per deciliter. So how do you manage during this desperate times when there is this coronavirus pandemic? So one, how do you prevent this illness in the first place? Two, how do you control blood glucose to an optimal level and ensure there's no complication? And lastly, how to prevent hypoglycemia.
Prevention of coronavirus infection in people with diabetes. Social distancing and isolation are now the buzzwords, which you keep hearing everywhere. Being asked to stay at home and avoid contact and travel is not easy in the long run. It can be very stressful, but having to think about diabetes when all this is going on can be overwhelming. In addition to all the factors which affects blood glucose, including infection, stress can worsen this. It's therefore important to get useful information to sort your emotions and overcome stress, if any. As we all know, high blood glucose reduces immunity by disrupting the action of white blood cells. You are more susceptible to infections including influenza, any viral illness like coronavirus infection, pneumonia, etc. Poor blood glucose leads to complications including kidney failure, heart failure, and these complications in turn can further reduce lung reserve and immunity. Hence, good glucose control is a key in reducing both the risk of getting infected and also reduces the severity of infection. People with diabetes should also follow the preventive measures recommended like social distancing and hand washing like others. Ensure you have adequate stock of your medications, test strips, food and drink, or gel for correction of hypoglycemia. Patients should maintain good blood glucose control. This would involve checking blood glucose regularly and more often if you're not feeling well. So what do people do if you're on steroids on a regular basis? Some people with Addison's disease, severe asthma, rheumatoid arthritis, inflammatory bowel disease, or connective tissue disorders are treated with regular steroids. Steroids can increase blood glucose levels. Steroids are known to increase the postprandial blood glucose, that is, blood glucose is more elevated after a meal. If you have been on long-term steroids, it's important for the dose of steroids to be doubled during the period of illness. Please do not forget this. Please do not stop steroids if you have been prescribed steroids by a doctor. You may need an increased dose of medication for diabetes to control blood glucose. Always discuss with your doctor or nurse on the changes you need to make to get the blood glucose within target. You may have to increase the dose of insulin or blood glucose lowering tablets for the duration you are on steroids, or you may even have to change the medication. Once steroids are discontinued, you could go back to your usual medication after discussing with your doctor. Now, people usually ask me, is there any treatment or preventive medications for coronavirus infection? There are currently no medication or vaccines that have been approved specifically for the prevention or treatment of COVID-19. Currently, these are being developed and would soon be available. However, people with diabetes should always have the seasonal flu vaccine. Now, coming on to the next topic, which is controlling blood glucose during infection, including coronavirus illness. Guidelines for managing people with diabetes who become unwell, also called the sick day rules. So these are the guidelines. Sick day rules are already in place in most hospitals and diabetes clinics. People with diabetes should follow the sick day rules strictly if unwell. The same rule applies to patients who are also diagnosed with COVID-19. If you have diabetes, it's very important that you know what to do when you are ill. When you're ill, your body becomes much more resistant to the insulin you produce or taken by injection. This means that your blood glucose levels can rise, and it is likely that you will need to increase your insulin dose or oral medication. You therefore need to monitor your blood glucose and ketone levels very carefully, especially if you have type 1 diabetes. If you have type 1 diabetes, check your blood glucose at least every 4 hours, including during the night, and check your ketones. If your blood glucose level is high, that is generally more than 15 millimoles per liter or 270 milligrams per deciliter or more, the target actually varies from person to person, or if ketones are present, follow the sick day rules and contact your diabetes team or emergency department immediately. Home management using sick day rules will depend on the type of illness you have and how you feel. You may have a minor illness if your blood glucose is within the normal range, or slightly raised if the blood or urine ketones remain negative. You could manage this at home if your blood glucose stays within a normal range. If your blood glucose is elevated and ketones are positive in your blood or urine, you may be having an infection or may not have had proper dose of medications or insulin. If you have type 1 diabetes, it's important to remember that when you are ill, you must monitor your blood glucose levels regularly, and you should never stop taking insulin, even if you do not feel like taking it. Managing your diabetes when you're ill. If you're vomiting and not able to eat, keep sipping fluids to prevent dehydration. You should drink at least 2.5 liters of water a day. If you do not feel like eating, try to have some soup, milk or ice cream, something which you can digest easily. If your blood glucose falls below the normal range, sip sugary drinks, fruit juice, sweetened tea, or have an ice lolly. If you feel there's an infection, contact your doctor or go to the nearest emergency department. If you're unable to keep fluids down and or cannot manage to reduce your blood glucose or ketone levels, you must contact the hospital as an emergency. Adjusting insulin dose will help to control your blood glucose levels. Now, what's the general guide to insulin dose adjustment? Note, it's very important. This is only a general guide and may not apply to everyone. Extra insulin will correct hyperglycemia, which is high blood glucose, and clear the ketones. Increase your usual insulin dose by 10% if your blood glucose is greater than 10 millimoles. You can use a short-acting insulin for correction of blood glucose like Fiasp, Actrapid, Novorapid, Humalog, or Apidra. Recheck your blood glucose and ketones in 1 to 2 hours. Repeat the correction dose of insulin at intervals of 2 to 4 hours if required. If you're unsure, always contact your diabetes team or emergency department. Now coming to the summary of sick day rules. You'll find there's a lot of repetition, but I'm going to repeat it again because it's very, very important. Check blood glucose at least every 4 hours, including during the night, especially if you have type 1 diabetes. If you do not test your blood sugar levels at home, be aware of the signs of high blood glucose. Ensure you're well hydrated. Have plenty of unsweetened drinks and eat small amounts at frequent intervals. If you have type 1 diabetes, check your ketones. If your blood glucose is high, that is 15 millimoles or more, or 13 millimoles if you're using an insulin pump. If ketones are present, contact your diabetes team. If you're struggling to keep your food down, try carbohydrates or starchy food or sweetened drinks with carbohydrates in it to give you energy. Keep sipping sugary drinks or suck on glucose tablets or sweets like jelly beans. If you're vomiting or not able to keep fluids down, immediately get medical help. Immediately get emergency advice if ketones are above 3 millimoles per liter. Start following your hospital sick day rules if your blood ketone is more than 0.6 millimoles per liter. If ketones are elevated, that is above 0.6 millimoles per liter, and you have any of the following, that is high blood glucose, excessive thirst, frequent urination, unable to keep food down, vomiting, dehydration, abdominal pain, breathlessness, or if you're likely to be pregnant, you will need emergency admission to the hospital to exclude diabetic ketoacidosis and treat the underlying problems or infections. If you have type 2 diabetes and are on insulin, you could use the following rule to correct your blood glucose. If your blood glucose is less than 4 millimoles per liter, treat as hypoglycemia. Have some sugary drink. If your blood glucose is between 4 to 11, just treat as you would normally do. So, if more than 11 millimoles per liter, discuss with your doctor and follow this regime. So you can clearly see on this slide that if your blood glucose is between 11 to 17 millimoles per liter, add 2 extra units to each dose. If it's between 70 to 22, add 4 units extra to each dose. If more than 22 millimoles per liter, add 6 extra units to each dose. But beware that it is different for each person, and you should agree this with your healthcare professional. If you're taking more than 50 units in total daily dose, you should double the adjustment. That is, if it's between 11 to 16 millimoles or 17 millimoles, add 4 units extra instead of 2. Now, if you're really unwell, your ketones are high, and you're vomiting and not able to keep food down, you should be hospitalized, especially to rule out diabetic ketoacidosis and or to correct infection if any. The doctors would immediately put you on insulin and stop most of the medications you're on, especially metformin and sodium glucose transporter 2 inhibitors like 𝒘𝒊𝒕𝒉, 𝒔𝒊𝒕𝒉, and dapagliflozin. Once you have recovered and blood glucose is stabilized, you can normally return to the medications you were on. However, the medical team would take this opportunity to help improve your overall blood glucose control and or add on more medications to prevent diabetes-related complications. One needs to be aware that some medications for diabetes can cause side effects more so when you're unwell. So metformin can raise lactic acid levels, and hence this is usually discontinued more so if you've got kidney failure. SGLT2 inhibitors like 𝒘𝒊𝒕𝒉, 𝒔𝒊𝒕𝒉, and dapagliflozin causes fluid depletion and acidosis, and hence this is also stopped, especially if your oral intake is poor and if you're unwell. GLP-1 analogs like liraglutide can cause nausea and vomiting, and hence this is also discontinued during illness. Pioglitazone results in fluid overload, and this again is discontinued, especially if there's a high suspicion of heart failure. Coming to the final section, which is prevention of hypoglycemia. Now, if you've got diabetes, it's not just worry about high blood glucose, but it's also low blood glucose. Hypoglycemia, or hypo in short, is when your blood glucose drops below 4 millimoles or 72 milligrams per deciliter. Normally, when your blood glucose starts to drop, you should start feeling irritable, hungry, and shaky. This usually gets better with a sugary drink, followed by eating some starchy food like bread or pasta. It's important to listen to your body and correct hypoglycemia immediately. If hypoglycemia is not corrected, it can result in serious consequences, including loss of consciousness and death. Not everyone gets a hypo. Some medications do not cause hypo. Hypo usually occurs when you have not eaten or taken large doses of medication or insulin to lower your blood glucose. Some people who have had serious hypo, that is requiring help from paramedics, are frightened of getting another one. Also, they do not want to get admitted in the hospital. During times of flu or coronavirus pandemic, it's always better to avoid going to the hospital unless it's an emergency. However, worrying about hypo is not good. Lots of people do worry about hypos. Some people with diabetes keep their blood glucose high to avoid hypoglycemia. This obviously reduces the stress and anxiety about developing hypos. However, running a high blood glucose can increase the risk of developing complications of diabetes like blindness, kidney failure, stroke, etc. So, how do you avoid hypos and also avoid worrying about hypos? So, in order to avoid hypos and not be anxious about running high blood glucose levels, one needs to follow the rules shown below. Ensure you have a routine, eat at regular intervals, keep recording your blood glucose with the time, dose of medication and food eaten. When you have had low blood glucose or symptoms of hypo, write it down. Analyze why you developed a hypo and how you corrected it. Have a clear plan for managing hypos and keep the necessary food and drink at home, in your car, in your bag and at workplace. Plan ahead if you're going to change your routine. Do not hesitate to communicate with family, friends and colleagues about your hypos. Always stay calm. Adopt relaxation techniques. Keep in touch with your healthcare team. Always plan ahead if you have to exercise or undertake any physical activity. Now let me summarize what I have said in this article and the video. The top 20 tips to manage diabetes during illness, pandemic or isolation. Follow your government or your doctor's advice. Do not panic. Wash hands regularly and maintain social distance. Avoid crowds and handshaking. Ensure at least 6 to 8 hours of sleep. Keep active while staying at home. Ensure you are well hydrated. Have a balanced meal. Stop taking SGLT2 inhibitor drugs if you become unwell, as there is an increased risk of serious complications called diabetic ketoacidosis. SGLT2 are tablets like canagliflozin, empagliflozin and dapagliflozin. Ensure you check your feet regularly. If you're unwell and seeing a healthcare professional, always tell them that you have diabetes. If you're anxious or stressed, you may contact Mind or any other body which can help you from stress and anxiety. Make sure you know how to manage the dose of your tablets or insulin during illness. Follow the sick day rules. Always have emergency contact number of your healthcare professional or emergency service. Ensure you have strips to check your blood glucose and ketones if you have type 1 diabetes or have poorly controlled type 2 diabetes, or if you are taking SGLT2 or sulfonylureas like gliclazide or glimepiride. If you do not check blood glucose or do not have a glucometer or test strips, be aware of the symptoms of high blood glucose, which usually includes tiredness, lethargy, increased thirst, and frequent urge to pass urine. You should be well stocked with medications, blood glucose meter, test strips, and adequate source of simple carbohydrate, especially if you're on insulin and or sulfonylurea, to prevent hypoglycemia. People with diabetes should have all the vaccinations for preventable diseases, including flu vaccine. Always communicate with family and friends and ensure they know about your diabetes. Please keep in touch with people with diabetes. Always discuss with your doctor, nurse, or emergency team before you make any changes to your medication unless you have an agreed sick day rule. I've given you lots of information. I would suggest you watch this video a few times so that you grasp the essence of it. And please do share with your colleagues or friends who have diabetes. Wishing you all the best. Take care.